So I saw a video of a sister of ours that said that estheticians and medical estheticians are the same, and the word medical in the aesthetics is for ego boost. Let's watch this video together.
Someone asked me the most ridiculous question today. She said, "Are you a medical esthetician or just an esthetician?" Excuse you. A few years back, I would have been offended by that question, but now I understand that people don't really know the difference. Actually, there's no difference. You're either a medical practitioner, be it a doctor, a nurse who does aesthetics, or you're just an esthetician. There is no qualification that you get that makes you a medical esthetician. So when you see medical as a prefix in front of an esthetician, it doesn't really mean anything. It's just an ego boost.
So I'm here as a nurse and a medical aesthetic nurse who is a member of the British Association of Medical Aesthetic Nurses to tell you that the medical in the estheticians, that the medical in that word, medical aesthetics, is not for ego boosts. Now, before we proceed, let me tell you that there is a difference between aesthetics and aesthetics and medical aesthetics. What's the difference? This person, they are the people that usually work in the salons, in med spas. You can actually put these and these people in the same category. Facials, dermaplaning, makeup, basic facial treatments. Depending. So what I'm trying to say here is these people work in the salon and in med spas, right? They do things like makeup, facials, dermaplaning, those basic facial procedure or beauty treatments, right? Now, these people, estheticians, are the people that carry out more focused skin treatments like dermaplaning, microneedling, and all those treatments, depending on their level. You know, there is level 3, 4, 5, 6, and 7. Now, these people, the medical estheticians, which I am, are people with medical background. They are not people that were trained for just 2-3 days for them to answer this. They are people that have more advanced trainings to carry out procedures. Beyond facial treatments, they also do things like injectables, the derma fillers and Botox. So contrary to what she said, that medical aesthetics is for ego boost, as a medical esthetician who is JCCP certified and BAMAN member, that is British Association for Medical Aesthetic Nurses, I'm here to tell you that it is not for ego boost. There is a distinctive difference. Now, in a situation where an esthetician does the training for level 6 or 7, yeah, they still, so this level 6 or 7 is the stage where the esthetician can do some minimal injectables. They still need the supervision of a healthcare professional. And that healthcare professional can be a doctor, a nurse, or somebody that has a healthcare background but has also been trained in aesthetics. Now, if it was an ego boost, tell me why I, as a nurse, that is certified in multiple countries like Turkey, Nigeria, UK, Australia, New Zealand, I still have to go through a foundation level. I still have to go through the foundation level in medical aesthetics for me to do the level 7. Is it that people in medical field are cursed with so much training? Is it that we are cursed with too much of training that we must always go the longer route. But then somebody that is just an esthetician who has gotten highest 3 weeks training can come out and say it is for ego boost. Anyways, I intend to teach more on aesthetics and women's health and anything else. I'm trying not to box myself in, but I want to major on aesthetics, right? For people that are thinking about going into aesthetics or that are in it and need more clarity. So if there's something you want me to teach about it, leave it in the comment section and we will face it. And also, if you are a nurse or you're about to get into nursing and you're looking for you have something that you need clarity on, also share it in the comment section or send an inbox and I'll teach about it. But I thought I should start with this so that people will know that there is a difference. Okay, now moving on, I want to tell you more about aesthetics. Now, you don't have to be a nurse for you to get into aesthetics, right? For you to step into aesthetics, there are pathways you can go in. Now, I'm going to tell you how I got into aesthetics and then proceed to tell you the rest on how you can get into it. So I'm going to be teaching you how I got in, how you can get in. This is to make sure I don't talk too much and then forget what we're talking about. So now, how did I get into medical aesthetics? First of all, the first thing I did, remember when I was getting into aesthetics, I had no guidance. So this is how I stumbled into it. When I saw IV therapy, infusion therapy, to be honest, if I had money, if I had guidance, the time I thought about this IV rehydration therapy business, not like when I thought about it, when I came across it, I saw that it was a thing in USA. Nobody else was doing it in Nigeria. I told my friend, we created an Instagram account, but that was all we could. My friend and I didn't have the money to pursue it, but that was how I stepped into it. I started with IV rehydration and it's still my best. I love IV rehydration. It gives me the most money. It gave me the most money at the early stage of starting. So this was all I knew for that for a while. And then when I got into Nigeria, I met somebody who already had a med spa and she told me she could teach me. And that was how I got my first level 3 aesthetic training. Then when I got into UK, I decided I was going to get the UK training because at that time I didn't know there was levels to these things. So I got my level 3 and 4, right? And then I proceeded to go ahead for level 7, which is still in progress. Now, while I'm still doing this, I have also done the educator training. Now, this is all the things that I have done. If I start counting how much it has cost me, this training, the first training, this IV rehydration training cost me $2,000. I got the training from a nurse that has a med spa in the US, but the training was done online. I got all the cocktail training, all the cocktail mixes and everything. I got this training for $2,000. That was the first training. When I came back to Nigeria, I got the first training with this, my friend. She charges 1.1 million naira. And I think I paid like about 1 million or so. So she charges 1.5 or so. So I paid 1 million for that training. Okay? That's how much now. That's like almost $2,500 thereabout. Now, the second training that I got inside the UK cost me £2,500. All right. Now, the education training that I have gotten is costing me around £300. Apart all these things are apart from insurance that I have to pay every month, and then the level 7 costs £8,000. So this is how much it has cost me to become who I am, and I know that it's going to still take more for me to continue. Now, I say all this to say that if you do not have a proper map, if you do not have a proper direction on how to go about it, you are going to waste a lot of money, a lot of time, and probably make a lot of mistakes. And depending on the country you are in, if you make a mistake with somebody's face or somebody's skin in this country, United Kingdom, and you don't have insurance covering you on your own, there's no difference between working in the aesthetic industry and being in the hospital. There is consultation, there is history taking, there is testing for allergic reaction. There are all those things because you're dealing with a human life, and any treatment you carry out on a person's body has the potential to cause the person death. To cause the person's death. I know you might think, how can treatment on the face make the person die? Yes. Do you know what they call allergic reaction? Do you know what they call anaphylaxis? Now, if you are not properly trained, these are the kind of things that you might get yourself into and you will not know how to get out of it. So many people in Nigeria go to the spa. I saw one that was trending about somebody that went for a medical pill and they almost disfigured her face. And I kept watching, checking, trying to follow that case. At some point, the case died down. Now, the person that this thing happened in her med spa came from the UK. But unfortunately, in Nigeria, insurance does not work. So this person does not have to protect herself with insurance. I don't know, but this is what I'm speculating, that this person wouldn't have signed up for any insurance. Now, there is no strong restrictions on what can be done and what cannot be done. When a patient has an issue in Nigeria, there is nobody to report to. But it's different in United Kingdom. You have to be very careful what you do. Even people that are even people that are estheticians, not medical estheticians, come out, are very careful of what they do, because if they are found out, if CQC catch you and you're doing what you're not supposed to do, you're in deep trouble. So if you want to get into the aesthetics industry, if you're a medical or a non-medic, but you want to go into this industry and you want to really understand what it entails, from my own point of view, from what I have learned, I have seen, I have known, your best bet is to start from level 3 or 4. Unless what you want to do is only treating, is only sculpture. You want to sculpture the feet. You don't want to be caught in between having to treat melasma, acne, and all those things. Then it's fine. Go straight for injectable trainings, level 6 and 7. But if you would want to offer services that can treat or offer consultations that can provide solution to skin problems, it's best to start from level 3 and 4. The reason for this is, if you are a non-medic, it gives you the opportunity to get at least the basics of anatomy and physiology, to understand how the skin works, to understand what makes up, why there's a difference between the skin, how the skin in the face behaves, and how the skin in the body behaves. Because if you don't know this and you go ahead for advanced trainings, you will find yourself lagging when they're talking about the basic things. So if you ask me, I would say go for level 3 and 4 first, understand it, work with it, and then decide if you want to stay there or move over to injectables. This is my own opinion. I'm not saying it's the standard, but this is what I think you should do. Now, you have decided you're going to go in and you have decided what level to go into. The next thing is, what kind of school should you go to? Let me tell you something. I'm going to hold your hand while I tell you this. There is a difference. There are differences when it comes to academy. There are people who just train and they'll give you a certificate that you have gotten that training. Those kind of things are things you can do when it comes to lashes, hair, basic facials, makeup. You can go to any academy. They will teach you these things and give you a certificate. But if you are going to be dealing with treatments, it is best that you go to an educator whose certificate is strong enough for you to use to get insurance. Don't just find a school online and sign up and pay, because at the end of the day, so many people go, get the training, get the certificate, and then they can't get insurance because the academy or the trainer that they signed up with is not eligible to give certifications. So at the end of the day, your certificate will not be worth it. And if you're outside of UK, if you are in Africa, in Nigeria, or whatever country you are in, make sure you're getting training from someone who is grounded in the industry and who can teach you not just the practical, but the physiology behind what you are doing, the principles and the rationales behind the procedure that you're carrying out. If you're going to be having a patient who has acne and you want to carry out microneedling on this patient, and you've been taught that when there is black spots that you can do microneedling to take care of this, Now you have no idea how that pen works. You don't understand the difference. You don't understand why you can use 0.5 in some areas on your face and 0.75 on some areas and 2.5 on some areas. All you know is that they said on this part use 0.5, on this part use 0.75. You will not deliver. Even your patient will know, even your clients will know that you are not confident in what you're doing and you have no idea what you're doing. But when you understand the physiology, the interaction between your skin and the products that you're using or the device that you're using, when you understand this, it is easier for you to confidently carry out a procedure knowing that every client is unique. That you did dry microneedling for me and it worked does not mean that the next person will not need serum added to it because of their unique issue. So it's good that you make sure that the person that is training you know exactly what they are doing. They teach you the proper way for consultations. They teach you the proper way of note taking. They teach you the proper way of protecting clients' data. And they also teach you to know when not to accept a client. For example, some clients just decide, you know what, I think I'm getting wrinkles here and here, or I don't like how my lips is here and here. I'm going to go and get a Botox. Let's say a 20-year-old decides that they're going to get a Botox. Why? Because it's in trend. And then they walk on, and then they walk into a clinic and say, and they come into your clinic and say, I want Botox. I want Botox here and here. Because you want to get the money, because you've been trained by somebody who did not sit you down and tell you that there are things that needs to be paid attention to. Things like having a one-to-one conversation with these clients to know why they think they need the treatment they're asking for. And be able to say, yes, I understand that you want Botox, but from my assessment of your medical history and what you are presenting, I do not think you necessarily need a Botox. Maybe a little bit of micro needling will fix the fine lines that you have. So you don't have to go as far as taking a Botox. One, because you are still very young. If you're not trained by somebody who understands the psychology behind all these things, body dysmorphia and all those things, you will not know what you're doing. You will just be getting clients, do whatever you want on their face and hope that it turns out good. So in all of this, I'm saying make sure you are trained by somebody who has strong background in what they are doing, can give you a tangible certification so that when you come out and say, I was trained by this person, you will be proud, your clients will be confident in you, and you can always reach out to the person that trained you for guidance. Okay, I think I've said too much, but this is my first video and I hope I was able to teach you something today. And let me know if you would want me to talk more on this. If there is any particular topic you have in mind you want us to talk about, leave it in the comment section and we'll revisit it. Okay, all right, I'll see you next time.